Today's presentation is made possible by the generous donations of supporters like you. The ARC of Massachusetts is deeply grateful to the hundreds of individuals, human service agencies, corporations, and foundations who are committed to enhancing the lives of people with intellectual and developmental disabilities and autism. At the end of the webinar, you will see a brief survey. Please take a couple of minutes to let us know what you think. Your feedback is important and will help us provide programming that meets your needs.
For those of you that are new, I'm Leo Sarkissian, and I'm at the ARC of Massachusetts, and we also, Terry Mahoney usually co-hosts these with me, and she's the Director of Education and Outreach. And then we asked anyone on our team if they were available to be on, and we're going to have probably at least 3 others on, just in case a plan comes out of this where we need to do a few multiple sessions or whatever makes sense. Okay, so just to share with you sort of how we'll do this, the agenda. It's going to be a few sessions on a few slides on how we got here. And I always do like a COVID update, but there's really not much of a COVID update because the state's only doing once a month updates now. So we'll just zip through that slide. And then we'll go to the main focus, which is really to have a dialogue today, which is why Kerry said some of you, if you could just say, so like, for example, yeah, like someone wrote no program. There you go. You know, that's a question. Or someone puts up, I'm in agency with choice, or I'm using the participant directed program, or I'm working with an agency to have some specific services because I don't have, day services right now, whatever that is. And then if you're a provider and are part of this, because you're a family support provider or autism center provider that wanted to be part of this, that would be great. So Kerry, you might want to chat, type into the chat. Please describe, your present situation. Okay.
Actually, I did. So
okay.
I'm looking and it says they don't see the questions.
Yeah, no, and that's interesting because this morning we had the same thing happen at the government affairs meeting.
Oh, okay. Yeah. So if you could just let us know where you're at. Is your loved one in a program? Did they turn 22? Did they? Are you using the agency with choice? Do you have access to any of the traditional day programs? Just really helpful to get a better sense of where everyone's at.
Okay, and I'm going to go ahead and play this. I think those of you that might have already heard it. Heard me say that we're just going to do a few slides on how we got here. And then basically the focus is what you've heard, which is addressing the services gap. Just for those of you that are new to the ARC, we have a federal partner affiliate. We're the state affiliate for Massachusetts, and we've worked together for, almost 70 years on advocacy in a variety of ways, and including the budget every year, including legislation, so on and so forth. So I'm going to skip through that so we could get to the meat of the session and the dialogue together. This is the agenda. You already saw about the ARC, so we did that one. We're going to do a 1-minute COVID recap. Then we'll talk about how we got here. And that also includes just updating you on workforce-related items and 766 compensatory services. So that'll come in as well. All right. So in terms of COVID, for those of you that have been on before, every month in the first week or by November 6th, there'll be an update, November 8th probably, unless it's November 5th, of what happened in the past month. So this basically and it really only reflects congregate care. So there's 8,782 people served through congregate care. Those are like small homes and settings, either through providers, which is about 7,700 of them, or 1,000 state-operated persons served through state-operated homes. And there were 58 individuals who were ill in September, and less than 5 passed away. So the month before, no one had passed away. So we're hoping that's what we'll see next month in the update. In terms of the workforce update, the week before, we said we were waiting on a new supplemental budget from the House and Senate. And the House did release a $3.82 billion budget, which includes $300 million in what are called American Rescue Plan, Home and Community-Based Services funds, And that's a reserve fund to help start addressing the workforce shortage, and 39 million in additional rate. There's a rate process called Chapter 257. So that's for a rate increase for people in work programs. And I'll touch on that. And when we talk about how we got here, providers that are private providers, their contracts are purchase of services from a state agency. In our case, right, it's Department of Developmental Services, it's a state agency. And that affects what a provider can pay for staff. The other good things that were funded, and there's more than these, but the ones that struck my eye were housing assistance, food security, and a $250 million funding piece in behavioral health, which is, you know, as you may know, some of folks, our constituents get stuck in emergency rooms or hospitals for a lack of behavioral health services. In 2018, so this is part of how we got here. Let me move this bar because I can't read. In 2018, we had released a report that's on the website that the annual turnover rate at that time in our field was 46%. Okay, 92% of caregivers through a study with the ARC, the University of Minnesota nationally, had difficulty finding staff. And Massachusetts, you know, at that point was rated the third highest cost of living. Someone mentioned today we're the fourth highest, but we're up there in terms of the cost of living. More recently, COVID-19 pandemic resulted in many staff being reallocated to residential when day settings were closed last March. And as you would know, day settings were closed for several months because of the risk of the pandemic. Places that only had day services temporarily furloughed their staff. And as things open, there was a huge lack of staff, not just in the day programs, but transportation. And as you may know, National Guard drivers were driving school buses. So we walked in post-COVID pandemic, opening up the day services. At first, there was safety restrictions, but then very soon, after some of the safety restrictions were lifted, people were struggling with getting enough staff to even have 40% day program staffing. Today, I'm still hearing 60% as an average. And I just talked to a colleague the other day who said she's not even at 60% yet. And then another economic factor is the Federal Reserve Bank of New York reported a few months ago that there was a 26% rise in for people who do not have a college degree who are looking for work. That's called a reservation wage. And that comes to $27.73 an hour. Now, you know, don't take that for gospel for 100% of workers, but it gives you an idea of why we're having some of the problem we're having. And this is, if you look at this chart, you know, the minimum wage is going to go up 50% in 7 years, 50%. So people knew we had a problem here, right, in Massachusetts in terms of standard of living and whatever. And some of the related and unrelated occupations, this is from the Bureau of Labor Statistics. And the first one shows what it is at a 75th percentile, $18.16 an hour. The mean, or the 50th percentile, is $16.29 an hour. And you can see community health worker at $20.19. Social services assistant, which isn't not even at the level we want of a staff person, $17.29 and $18.68. This is the sort of recent rate. I told you there's a rate process that determines what people get paid. If you look at and just note the percentage on the right are the ARC's guesses, because there's no, except for one of the years, they don't list the programs that are funded in a rate reserve. Every 2 years, rates are calculated. So in residential, the rates are being discussed this year for next year. Last year, they discussed the rates for day and employment programs, family support services, and some related things. We make a guesstimate across the Secretariat, across Health and Human Services, what DMH programs, Department of Mental Health, Department of Developmental Services, what are those agencies that are getting affected by the rate that's being published? Because it's not just publishing what DDS rate increases are. And we basically then, try to speculate on what's available for an increase in cost of living. Now, the reason that's really important is 70% of our typical contracts that agencies have are in personnel. So if you have a rate increase of 2% and assume, that's a provider is only going to do 2%, and some years might not even do 2% because they've had rent go up or they've had other costs go up. So it might be 1.9% or it might be 1.8%. But this shows you for those years until 2020 what happened. And that 160 million that was potentially 6%, we were lucky in February of 2020, the Secretariat agreed to do a 10% increase for DDS residential services. We weren't lucky, we advocated because it was so tough before COVID, the situation with the workforce as it was. And that left only a couple of percent for the other agencies getting funded, but the huge majority was our field. And that amounted to 125 million of the 160 million that was available that year, just to tell you, and I think if COVID hadn't happened, maybe they would have supplemented that reserve because they would have realized, how out of kilter it was once they had committed to 10%. This year for the day programs, it was going to be somewhere around 4%. And the administration agreed to increase it because of the wage piece of it. And just so you know, the wages were benchmarked until a few months ago at $15 and about 50 cents an hour. And that's not just entry-level wage. So again, I just wanted to explain to you how we got here. And now it's for day programs, it's at $16.79 an hour, which we're getting somewhere, but we're far from where we need to be. So every year there's a process for a certain number of services, and we try to advocate for the highest amount, and people can advocate with us for those goals. And then I just want to touch on the education for those of you that still have, loved ones that are either 21, 22, even if they're 22. If you, and Kathleen, jump in if you want. Kathleen Amaral is a team member and on a school committee, but right now there is funding available for compensatory services. We're supporting a bill for that purpose, but it looks like we got feedback from the committee saying, hey, look, these funds are available. We may not need this bill to pass if people will just, make sure their individual educational plan does ask for compensatory services. So you have to do that. And the district will be required to provide these services. And it's regardless of whether they turn 22. The supplemental budget provided 20 million for workforce sustainability of private educational schools. The House American Rescue Plan bill allocates another 10 million, but it also 10 million was expressly set aside for students that turned 22 during the pandemic for compensatory services for adults that reached age 22 during the 2019 pandemic. And finally, local districts can also use federal educational money, that's what SE is, to fulfill this obligation, which there was extra SE money provided. All right, so that's the background. Is there anybody have questions on the background before we talk about what we could do together? Okay.
So, Leo,
Yeah.
I have a quick question. This is Paula Collins. How are you?
Hi, Paula.
If somebody turned 22 in 2019, who do they go back to? The district?
Right. Well, first is Kathleen. If Kathleen, you're on right now, I would say go to the district because it said, if you notice that money, the 10 million, Paula, that they mentioned, it expressly talks about the 2019 pandemic. Right, Kathleen, am I right?
Yeah. So if you, and just to elaborate on that, like the three pockets of funding, like the ESSER money has come to districts. The ESSER 3 money in particular, 20% is set aside to help students who have been impacted through COVID. And, ideally there are districts who, through the stakeholder engagement that also had to happen. I mean, they had to engage with the stakeholder group, one which included, and the listing is quite extensive as to who they needed to kind of reach out to help formulate the plan of how they're going to spend money, was families of students with disabilities. It had to happen. But 20%. So ideally, yes, what that looks like, that's another story, but it is worth having that conversation and reaching back out to if that's necessary.
And it looks like
Yeah,
Lucy's
I've
got a
not
hand.
heard that
Oh,
and
go
haven't
ahead,
heard from my
Paul.
either. That's interesting because I haven't heard from my school district at all and had no idea what was happening. So I guess I got some work
I
to do.
think we've got to put on social media that this is something we've got to encourage families to do. And I think we need to be more aggressive on our end to educate people and give them a heads up. But the school district should do it. You're right, Paul. The school district should be educating people. They're funded, right, to do it. So shouldn't let them off the hook. So
About to answer a question online. What? Come in. All righty.
Lucy, Lucy, do you have a question you wanted to ask? And I know there's another raise.
Can you hear me?
Yes.
Okay. Yes, I guess maybe I was distracted for a minute because somebody came to the door. Can you provide documentation in writing someplace where families can know how to access this money and prove to school departments that this money is available?
Well, that's pretty bad that we got to prove to a school department, right? That's, I guess there are some school departments that I get it, and I shouldn't act so naive. Kathleen, you sent me something recently.
Yeah, I can put some links in the chat as well. I have them up in my background.
Yeah, I think she's
just some
asking
fact
us, but
sheets.
reshoot me what you sent, and I think maybe you and I could talk offline, and we could write something on and put it on social media. I think that's what she's asking us to do. I get that.
And
Yeah.
Leo, this is Mara. I was just going to say that some of that new money that came out of the SUP budget is new. So that will
Right.
be something that schools will just be kind of getting in
Hearing
processing.
about, right? And just to be clear, the Senate's we're talking about the House's new budget, correct? The House's new SUP okay. So that means
Exactly.
the Senate's still got to act on that second 10 million,
Yes.
just to be clear. I'm glad, Maura, you said that because that reminded me it's not kosher yet, right? It's not out
Yep,
there yet.
exactly. Not yet.
Yeah. So somebody else, but there's other sources, and that's what we can put together, and we can say, we expect, this other money to happen. I would be shocked. Yeah, go ahead. Go ahead. Go ahead. You raised your hand. You got your hand raised.
Okay.
Sorry.
Okay, yes. Has there been any discussion about kids that are in the transition program now that lost basically a year, but they're not turning 22 for another year and a half? They've lost a year, but there doesn't seem to be anything for making it up. They got stuck in a classroom, not doing any of their, community vocational training that they were supposed to be doing because of COVID.
They fall in the same category. And if you face a problem with that, please let let Kathleen know, one of our team know. And
Leo.
yeah.
That's
if I may.
exactly,
Go ahead,
sorry,
Mike.
that's exactly what I was going to ask. Is my son is turning 20 in December, but he had been online for a year. So when
Right.
you, it all went by so quickly when you were
Yeah.
talking. I didn't understand when you said, even if you're not turning.
What I was
20
getting at was, the harder one, which is, we were talking about the hardest, which is someone's already graduated, right? And they've got to go back to the district, which Paula was asking about. But I think, it should be easier. Easier is relative, let's be honest. And to be someone who's younger, right? Because you've lost it, you're still part of the district. So again, we're going to put a short page together on that and share that. Carrie, go ahead.
So if I may, I actually have a success story to share.
Great.
In partnering with our school district. As many of you know, Bobby is medically complex. He's not fragile enough to have, 24-hour nursing or, doesn't have a trach or anything like that. But when he needs care, he needs it immediately. And he also has very few antibiotics that are safe and effective for him. He has not been in a classroom since March of 2020. He's fully vaccinated through his booster. We collaborated with our school district Situate because he missed well over a year of services and he couldn't access remotely the way other kids could. So we currently, developed an IEP in June with our school district Situate. No legal involvement needed at all, just a team working together. We had some data from the ABA services that was able to come in. And Bobby has 65 hours a week of ABA services provided by PACES, which is the Pilgrim Area Collaborative Extended Services. And they are providing a completely individualized transition. The biggest concern was with, breakthrough infections. He would not be able to adjust well to going to school and then everyone isolating for 10 days and going back and forth. We needed to develop something that was solid for the remaining 9 months.
So Situate
And-
jumped in. So you have so it's really important. And I think there are certain school districts that are going to support it, and or you have a relationship, with the case manager at a school system who's going to go to bat, right? It's either one that they'll be responsive. So people should not be nervous about, doing that. And again, we'll put a short pager together, and, Carrie, maybe we can use your story as a social media blip too, okay? To tell people it's possible. All right.
Well, and the key was the data for the people, the outside agencies that were coming in, they had the data to prove that this was working. So it made it easier for Situate to say, yes, we agree with you. So you got to have something to base it on.
Thank you. What I want to do is, first place I want to thank, there's a few folks from DDS on. I want to thank them for being on, because I think you guys can help us in terms of, I'm not spotting you guys, but feel free to jump in later, because we are going to talk about the adult stuff. And I know you're as concerned as we are about this. And so I do want to, touch on that as well. Let's take one more school thing and let's switch to the adult situation where people, so imagine there's been 2 fiscal years that we've been in COVID now, okay, that students have graduated. If you think about it, because FY20, basically would have been, FY20, fiscal year 20 would have been the first year that a whole bunch of people would have graduated during that year and would have faced nothing, right? Would have had 0 and or virtual through the school if they hadn't quite graduated before June. And then you have this past year that people graduated that have hit a wall. So I don't know if we're talking about, on average, it's 1,300 people a year. So just to give you an idea, if there's out of those, maybe some did get served. Some had more independent kind of services. But we're talking about quite a few people that are in this situation. Originally, we didn't think it made sense to do a statewide thing on it, because it's like we have to find local solutions, right? But the organizations that we talk to, their bandwidth is full, just trying to get people back in that they already served, okay? And one of the ideas we had, we're hoping, bottom line is we want to be helpful on the local level and find out from you. So if you have an adult success story where you figured out something with a local group and or use participant directed, or want to give an example to the group listening in right now, I'd love to hear that. Secondly, I'd love to have that conversation to figure out what we can do to organize so that we can have some solutions in the short term locally. So got a hand up. Let me look at the names here with the hand up, because I don't necessarily, I got Susan, is it, hold on, is it, yeah, Susan? You got
Yes.
your hand up?
Yep.
Go ahead. Good.
So I'll just give an example. My son is now 25. During the pandemic, he was doing better in the group home than he did at his day program. There were too many transitions. So through a group that initiated through Facebook, we advocated for a sightless model. And so that is how he's being served. There were a lot of difficulties because the house manager wasn't taking responsibility for the day program. So we had, it was hard what was implemented. At the end of the day, someone fantastic was hired in August. Another housemate, my son is served by CBDS. The other housemate is served by DayHab. There is somebody else in the program also served by DayHab. And so he has what we call a sightless model. They are getting out in the community every day. They're going to different parks. They're sending me pictures. They have gone bowling. They did go to a library last week and sent me pictures doing puzzles in the library. So that is moving in the right direction in a new model that for him, it's working better. That wasn't here before the pandemic. So that should be a model that people should be aware.
Yeah. So in your situation, Susan, is it residential staff that they're doing, whether they hired them or not? Is it through the residential, or is it a collaboration with the CBDS, the DayHab, and the residential?
So you're asking a really excellent question, because when it comes to the day services, it's not the residential responsibility. So actually the agency, which is Charles River, has someone who is responsible for the Sightless program. And then they have separate staff that is responsible for delivering the day services. And it does operate out of their house, and they can go to another group home. And I really envision it to be much broader, that there might be others in the community. I mean, maybe they can go to the day program, have
Sure.
lunch. And so there's more social pieces I think have yet to be worked out, or say this broader. It's not just the people in your program, but yes, it's different. Separate staff providing day services.
So, okay. And this is a really important question for that is your residential a different provider? For
No.
your son? No.
No.
So this is really important for those listening. So in terms of bandwidth, you know, and I give credit to where credit's due, you know, don't get me wrong, they're an affiliate of ours. So I'm very happy to hear they did that. But when I hear agencies feel like they're full up on their bandwidth, you know, this is great. And it still takes quite a bit of work to get it done. So let's, you know, and we are going to document that, Susan. Thank you. That's
You're
great.
welcome.
And so it does help if someone's also the residential provider. Now, somewhere else, it might not happen, by the way. I'm not saying it happens automatically, because it does take a lot of work. And you could hear in Susan's voice sort of took time, you know, for them to figure this out, you know, and it was a process. Nicole, you have your hand raised. Nicole? Yeah.
Yes. Can you hear me?
Yes, go ahead.
Hi. So I'm the executive director of Sing, Explore, Create. We're a private music therapy company.
Say the name again, please. Say the name. Oh, you muted yourself by accident.
There, is that better?
Better.
Said the host mute. Okay. Sing, Explore, Create. So
Okay.
we're a music therapy practice that we, for years, have partnered with bringing services into day hubs, residential programs, CBDS. And so when everything happened, we were able to stay open, and we continued to find ways to serve the population. And so we had actually, over the summer, with Plymouth Family Support Services, had piloted a program here at our center. And we were able to provide a 2-hour program originally geared towards our agency with choice families. But we ended up with a lot of people who weren't able to attend their day hab, you know, the 5 days a week. And so we were able to grow that program. And so now we're offering it 2 days a week here. And we're really looking to continue. We know we hear from families all the time. They're just looking to get creative with services.
Yep.
So
You go places?
We do. We absolutely do. Yep. Yeah. We're
Okay.
out. We go into residences as well as day habs and a bunch of
Okay.
other places. So, but it's worked out well, because we've been able to, some people have support, PCAs that come with them, and some don't. But we have a physical space here that we're able to provide some programming for, which has helped a little bit, I hope. And I'm just kind of here to listen to see what the needs are and where we might be able to jump in and help out as well.
Great. That's awesome. Thank you for sharing that. I think Liz, you've got your hand up. Liz Fahey.
Yes. Hi, Leo.
Hi.
Hi, everybody. Just kind of jumping on what Susan said. So my son is 26 and he does self-direction right now, which I manage. Not sustainable. So we've got to figure that piece out. But I will say that there are a couple programs that he does in the community. One is the Muse Foundation, another is called Positively Goats. And they have been able to partner with DDS, and DDS pays them directly. And I see that as a real success story, and I'd love to see more opportunities like that. And it's a nice solution, because I'm working with some other families who are doing self-direction and struggling with ways to keep their kids connected with other young people with disabilities. So I'm just throwing that out as a suggestion, but I see it as a great model. And kind of as Susan just spoke, DDS seems more and more open to partnering and doing that. So yeah, that's what I wanted to add.
All right. And the names of like when you said, I just want to jot them down.
Yeah.
I don't know if someone else got them. Yep. Go ahead.
One of them is called the Muse Foundation, MUSE.
Okay.
They're based in Brookline. They were started by 2 transition teachers from Brookline who had kids transitioning out and wanted to be involved in music. Fabulous organization. The other is called Positively Goats. It's in Natick, Mass. It's run on a farm. The woman who runs it had experience at Riverside and has a curriculum. She teaches how to people care for the goats. There's a little bit of education, socialization. It's a great program.
Great. Thank you. Thank you.
Sure.
I'm going to take a pause and then go to you, Kathy. Just give me a minute. So one of the key things here is like thinking, obviously, other groups, right, that are out there that are outside of our traditional system. I know we were thinking about, related to that, are there civic groups, social groups that have networks that a few families could get together in a local area? Okay. And can we help facilitate that? So I'm going to leave, I'm going to have Kathy speak, and then I want to take a few minutes here, because for people that are still like managing everything and in the middle of stuff, I want to see what we could do to facilitate some local stuff that obviously we can only facilitate it. We're not local, we're statewide. So, but I'd love to figure that out, because some of you are day in, day out, right? You're doing the stuff, right? And like you were saying, Liz, it's not sustainable right now the way it's going, but it's at least some kind of activity and exposure and inclusion that you're happy to see happening. Kathy.
Hi, yeah. So I wanted to share that there's a bit of a structural issue. When we came out of lockdown, one of my goals for my son was to have him not go back to his day program 1 day a week and have a day of self-direction. And he lives in a group home. And what we ran into was, it took 8 months of negotiation.
Wow.
To get him 1 day a week out of day program with a tutor coming to see him for an hour. And the reason for that was that because he was in a group home, they said they couldn't do self-direction. They could do agency with choice, but they couldn't write the contract if the tutor got paid more than the ALTR staff at the group home. Now, I need to pay the tutor $60.
And Kathy, can I ask you a question? Were you paying the tutor through a company or a contractor, or paying the tutor? Would the tutor get paid directly?
We had
I know.
not hired
Sorry
the
for
tutor
those
at
of you
all.
listening in with my absurd questions, but I need to dig down.
The tutor at all at this point. We were trying to figure out the payment mechanism.
Okay, so you were open to paying them directly, correct?
Right. So, yeah. So where this finally went, the good news is that DDS gave us 6 hours of ALTR so that he could stay home from day program, but they could not figure out how to pay for the tutor. And what they finally wound up doing was they said, we're going to reduce his service fee to his group home agency by $60 a week. And then Terry can pay his tutor directly out of his rep payee, Social Security rep payee account by Venmo, which essentially meant that the group home, they got the 6 hours of ALTR, but they're now losing $240, $50 a month on this.
So Katie, I'm going to stop you there only because I want to leave enough time for some other stuff. But you're bringing in policy. There's policy considerations on all of this. So I just want to tell people about a group that meets. Right now, we're meeting more often than we did. It's called the Mass Alliance for 21st Century Policy, and it's something that we have our next meeting tomorrow. But it's focused on self-direction. Okay, and we've developed like a fact sheet around how funding for self-direction is figured out. You're welcome to see on our website. But we're also looking to go big time into talking and with DDS and others about really realizing the real lives law, which is sort of part of what was getting in the way of what Kathy was doing, not the full realization. So I just want all of you, because at the end of the day, Congregate Care is here to stay to a certain extent, but we'd like to see supports packages and see self-direction to be more available. And what do I mean by sports package? I mean what you guys are actually talking about today, where there's different kinds of alternatives that are developed. And obviously it can't always be on the burden of the family to coordinate for the rest of their lives. And we got to have a legacy plan, right, for these supports packages. And that's the kind of stuff we're working on through that group. And The state also has a advisory board that meets called the Self-Determination Advisory Board, but we haven't gotten into these probably level of discussion, and COVID had a huge impact. I think we would have gotten into these things over a year and a half ago, but COVID got in the way. So what I'd like to talk about, some of you are probably, anyone want to get on and feel like nothing's going right for a couple of minutes? Tell us about that. Or I'd like to figure out a local strategy. Do people have suggestions on groups locally that if we were able to help figure out a situation where you don't have to wait like Kathy did for 8 months for the solution, that we could see about some solutions. And I actually developed a chart, which I'm not going to show you because it's my chart. I wanted the state to be in on it with me, but let's just assume for the sake of argument, and I'm surprised I didn't put it on the spreadsheet. I'm going to see if I can pull it up here, the Word copy of it. Actually, it's right here in my hand. Sorry, I can't show it to you, but let's assume your annual allocation. I looked at 21,000 a year. I looked at 25,000 a year, and I looked at 40,000 a year, because it would not be unusual 40,000 above for people that had more intense need for intensive services. But if a typical budget during the day is in the 20s, low 20s to mid 20s, and part of that means you have to pay, let's say you hired someone, just for the sake of argument, let's say 5 families got together and they wanted to figure something out in the South Coastal area. I'll pick that since I worked there like over 30 years ago. Okay. And you had 5 families and you said, you know what? We each have X amount of dollars, right, coming in. And what I asked the folks at DDS, I'm going to ask them again, for somebody just to sit down with us and do some crunching together. So one way to access services is through what's called a participant directed program. Now, the good news about that is you can directly get involved in getting resources. The bad news is you have to be involved. Okay. So it's work, right? But let's say I looked at, okay, let's say we took away the cost of whoever the middle man or woman is, and you paid $20 an hour. Even with the lower amount of money, 21,000 a year, you'd have about 935 hours during the year. And you figure out the weeks of the year, whatever, you're probably talking about 18 hours a week, just to give you an idea. Okay. And again, this is all based on, what you pay someone. And you have to think about the 10%, the 11% payroll, those kinds of things. And clearly money is not getting spent right now. So I'm hoping the 10%, 11% payroll would be an add-on for everybody because you're also not using transportation. And that costs a few bucks. Okay. So then the question is, what's the middleman or woman? If there's someone to help facilitate this, could there be a special plan during this crisis period where a subset of DDS employees that should be doing their ISPs could get reallocated to work on this? 1 or 2 people in each office, right? And I don't know, again, this is being sort of practical and down and dirty and try to figure out strategies that can help people on the ground. So we want to be helpful around that and think through things, but it's not going to happen in one meeting, So if people want to delve deeper into this, anybody have some suggestions? And you may have some suggestions. I just threw out one idea of where things could happen, where hopefully, can't take 8 months to work it out. But, and I don't know, Carrie, if you're seeing stuff on the chat that you want to comment on that people are making suggestions to. So I'd like to continue the dialogue if people want to continue it. Where are people at? Should we be continuing this dialogue to see if we can come up with some solutions?
Yes.
Some people are saying yes.
Yes.
This
is Paul again.
Seeing, Leo.
Go ahead, Carrie.
Oh, thank you.
Go
What
ahead.
I'm seeing, Leo, is who have kids with behavioral difficulties, just real challenge.
Right. And we heard you muted yourself. Well, yeah. And what our experience is too, it's not everyone, but some providers say those are almost the last people to come back, those that were getting services because of the staffing crunch, right? And I've got a colleague of mine, Pam, agreeing with me from DDS. So she's got her head. Why don't we schedule, is this time of day good? What if we schedule a couple more problem solving meetings? Because we're just at the top of it. Or would you guys prefer 5 o'clock, 6 o'clock? I'm open and my team's open. We want to figure something out that's a dialogue with the team. Obviously this is close to people's hearts. The turnout today is somewhere over 100. Okay. I won't even, And again, we put this off. I wish I'd done this a month ago now, obviously 2 months ago, because we've been talking about this issue for a few months with our friends and colleagues. And so, and Turning 22 is fun to know. Yeah, it is capacity, Susan, you're right, but it's people, right? So, and again, we've been talking to people, Kaiser Family Foundation, we've been talking to people in Wisconsin that do self-direction. There's 9,000 people in the Wisconsin program, self-direction. My colleague, Robert Beckett, had turned me on to Wisconsin. So then I reached out to my colleague there, the state exec, and she put me connected to the person who worked on that program. And one of the things that we find both in Massachusetts and elsewhere, and you guys that do it, you can pipe in here, is if you're doing something from your network, I know some people are isolated, but if you're in a network and or you get friends involved, suddenly you find people that the average provider isn't going to find, okay, to participate in our field. And that's been our experience. So that's not 100% true, right? Because if you're more living an isolated life and you've got 2 jobs as a parent and you're raising your kids, yeah, you're probably not going to have that network unless you have extended family around. But it is true that as a rule that we found that with self-direction, and the Wisconsin experience is true for sure, that other people are brought into the field, so to speak. The other thing, well, let's stop there and let's see about, having an, maybe we should just make the next few meetings. Is this a good time of day to keep going?
Yes.
Okay, this time is good. And I do have, so I have a colleague coming in from the Independent Living Centers next week, but I'll move his session to a different day of the week and maybe a different time of the day to try that time out. We're going to talk about independent living. And let's pick this up where we stopped. And we're recording this, by the way, and I think we should make this available as soon as we can, if Katerina can. Gary, any other suggestions before we stop? Because we want to think about next steps. Yeah, Carrie. Unmute.
Please include the people who are medically complex, and there's a bunch of people like Bobby who fall in the middle where they don't qualify for skilled nursing services because mom and dad are doing it.
Right.
And when mom and dad aren't here anymore, they need that care whenever they need it.
Thank you. Yeah. And I think, so we have a close colleague who ended up using training PCAs for a lot of that and recruiting people. So maybe we just need to talk about some basics too, right? That people have done, that have worked. Yeah, Carrie.
This is really important. The biggest thing we've run against is the Mass Nurse Association precludes nurses from delegating skilled tasks to PCAs. So you cannot have a publicly funded person doing something that is considered a skilled task. They can empty Bobby's ostomy bag, but they cannot change, assess, all the things that we as parents do. We change trach ties, we do all of that, but the block.
We're going to look into that. We're going to look into the policy on that. Thank you, Carrie.
Yeah.
Did someone get that down? That policy, Ellen or Kathleen, can someone get that down? I typed some other stuff up. I didn't type. Well, you know what? I can type that up, but let's get that down. So I got a feeling,
Greg, yeah.
I got a feeling that maybe the colleague we know did it anyway, and she was there some of the time, so she probably was overseeing, or who knows what she was doing. But
the person, Nancy Noble with DDS, is the person who explained that to us.
Right. No, I'm not surprised about that rule. I just don't think it's practical at a time like this. If you're able to train someone yourself and you trust them and that they performed well. And we did this in 92 or 93. It was a terrible nursing crunch. And we invited 8 people into our office for a dialogue on that. And we found the most successful person. So all these parents were in their 30s, the majority of them, they were dying without coverage. This 56-year-old parent had a neighbor she had trained that worked 45 to 50 hours a week for her, and she had trained her on all of that. And, and she was a member of the family, like, you know what I mean? And that's, again, unusual situation. And I know someone else I got to hear from, I think she's in Middlesex County, and I have to track her down. She has 7 to 9 staff working right now through self-direction. And I was really impressed with it. And still through the COVID crisis was able to manage, people didn't get sick and all of that stuff. So they were careful. And I have other people I know that cut back on staff to be safe. So let's follow up next Monday. We'll stick with this theme. I'll reach out to my colleague, and then my team's going to meet this week again in a couple of days, and we'll regroup and figure out how to get to a problem solving. And maybe we break this up. Maybe we break it up into those with medical, those with behavioral, right? And I don't want to say typical, because there's no one's typical. Everyone's different. But maybe we figure out to break up into groups during the session. And
I think that's a good idea, Leo.
The rooms, Ellen? Yeah. So
absolutely.
We do a breakout room next time, okay? And talk together. And eventually maybe with the breakout rooms local by region, which probably would be helpful to each other, right?
Yeah, Leo, this is Mark.
Yeah.
And I just wanted to add one other thing from the chat too. If you've already had the conversation about compensatory and you either passed on it because at the time, gosh, it was hard to assess how much our kids had regressed or what skills were going to come back when they entered back into a non-virtual environment. So I think a lot of people were hopeful and maybe had the conversation and said, I think we're going to be all set, or took 6 hours of compensatory, right? And now, months later, we're seeing the regression, we're seeing skills not coming back, we're seeing the lost opportunity, and it's worth going back and having that second conversation about compensatory, even if you already signed off that you didn't need it. But I think the big thing is documenting, right? So we all have to document what we're seeing. So I just wanted to add that.
And I want to just, there's a question about the ESSER 3. And I think that's what we're talking about, Kathleen, right? In terms of the money, just because school departments can use the money that way doesn't mean they want to use the money that way. Is that fair to say, Kathleen?
Yeah, and let's be real.
Yes.
They're also dealing with, it's a myriad, mental health and a lot of that overlapping.
I think what we're trying to give you is tools when we say that there is funding available, and don't just, get pushed back. And then our friends I was going to say Amy and Pam, and I think Ingrid was on for a while. I don't know who else, but if there's, if you guys want to chat too and have a chat about behind the scenes and strategy, because we brought this up just Wednesday for the second time in probably a month, with our friends, our colleagues in your agency, just to talk it through a little bit. And I think people were so concerned about the staffing crisis at that point with the vaccine, the mandatory vaccine. I wasn't able to get much. We weren't able to have a true dialogue. So, and again, I totally get it, but okay. So we'll see you guys. We're going to break up. We're going to talk about how to break this up. If people have suggestions, they want to email to Carrie or I, and MAHONEY at arcmass.org, or Sarkissian, SARKISSIAN at arcmass.org. Feel free to do it. And I really appreciate the level of dialogue, and let's figure this out together. Okay.
Yep.
All right. Thanks, everybody.
I just wanted to let people know that Joanne Pino from MAC, Mass Advocates for Children, is going to be doing a webinar for us in February, not February, November. And she's going to be covering compensatory services.
Oh, that'd be great. Okay, she's going to.
So if you haven't signed up for the transition conference, check her webinar out, because you'll get some good information.
If there's a topic we left out, you want to just email us or nudge us on that, please. Please feel free to do so. Okay. All right. Take care. Bye-bye.
We hope that you found today's program informative and helpful. Please take a minute to complete the survey and provide us with feedback. Donors like you make the work of the ARC of Massachusetts possible. From webinars to the multitude of resources on our website, to budget and legislative advocacy, to programs like Operation House Call, the ARC of Massachusetts depends on the financial support of people like you, corporations, foundations, and human service agencies. If you are able, please consider making a gift today. Visit www.arcmass.org/donate.